Adam, please introduce yourself. And then Daryl and then Ahmad can introduce themselves.
Hi, I'm Adam Rosenberg. I'm one of the founders and on the board of Kehillat Harlem, the first new synagogue in Harlem in about a century. I'm also one of the ICLA fellows of this season, and I like pickles.
I see. Thank you. Daryl?
I like
My
name's Daryl.
Oh, there you go.
I actually also work for Met Council, so
great. So this is like a full-on Met Council.
Exactly. But I'm the food policy fellow currently and helping out with some of our statewide research on kosher and halal food. So
amazing.
Nice to meet everyone.
Thank you. Ahmad, do you want to introduce yourself?
No.
Okay. Ahmad is on ICNY, part of ICNY staff. So
Hi guys, my name is Amar. I'm the Deputy Imam and Assistant Director for Community Engagement and Youth Activity at Masjid Al Haram in the Bronx. I'm also the Outreach Coordinator for Asylum Seeker Shelter Program. Oh, I finally memorized it. At the Interfaith Center, we work with NIDIS to provide shelter spaces using House of Worship for the asylum seekers.
Thank you. Maybe Gabrielle wants to introduce. I know Gabrielle's also at Met Council, so I mean, I would love to know who Gabrielle is as well. If not, then Karla and DJ, please take it away, because I think this is going to be very informative. And like I said, we're recording this, so we're going to post this online.
Also, Ben, if you want to introduce yourself, maybe after Gabrielle too.
Yes. Sorry, because I met Ben, so I was like, wait, so sorry. Go ahead.
Hi, everybody. Thanks for being here this afternoon. I'm Gabrielle Williams. I'm the Director of Operations for the food programs here at Met Council. I support our data work and also our policy team here. So I'm excited for you all to hear from them and our dear Karla, who's leading the charge on some of this great work that we do externally. Nice to be with you all today.
Thanks, Gabrielle. Hi, everyone. My name is Ben Zients. I'm the Senior Manager for Agency Relations in Met Council, overseeing our work with pantries across the board, both kosher and halal, across New York City and beyond. Really excited to join in this conversation, to think strategically together how to best serve our communities that require religiously informed diets and with the intersection of food and security. So excited to hear from Karla and DJ and to engage in this conversation.
Karla and DJ, the floor is yours.
Yeah, I was gonna say, Karla, do you want to introduce yourself, and then I'll start and do the deck.
Sure. Hi, everyone. Thank you all for being here. I'm very happy to see my colleagues on board with us. I am Karla Kay. I work with Met Council under Ben, our agency relations team, as the Halal and Community Food Coordinator. It's a relatively recent position relative to our years and years and years of work in the emergency food world. And I just want to say, despite the dense Met Council participants here, I think this could be a great space for brainstorming with everyone and for just thinking about how we look at religiously inclusive food in the city and beyond in general. So very much looking forward to speaking to you and with you. DJ, I'll hand it off to you.
Thank you. So yes, I'm DJ. I'm the food policy manager here at Met Council. I'm gonna share my screen just so we can do a brief little introduction to who Met Council is and what kind of work that we do. Everybody can see this. Okay, so everyone can see my screen, we're good. So yeah, we are Met Council. Like Karla said, we've worked in sort of the poverty space for a very long time, for about 50 years. We have a variety of programs. We operate affordable housing buildings in various locations throughout the city. We offer benefits access services. We also do a lot of work with domestic violence survivors and crisis intervention in domestic violence situations. We offer senior home repair services to allow seniors to stay in their homes and make them more accessible to them as they age, so they can age in place. And we also operate a food bank and a handful of food pantries. Our food bank serves, as Karla said earlier, anywhere from about 100 to 150 pantries a month, and we serve exclusively kosher and halal food, but we serve it to anybody and everybody who is in need. We don't have exact numbers in front of us, but a large portion of our clients are maybe not kosher halal observant, but because we serve kosher and halal food, it's accessible to folks both with and without religiously informed dietary restrictions, allowing us to meet the needs of all New Yorkers. In addition to food banking and pantry work, we have some unique work within the food space. We operate a market, it's called Market by Met Council, and it's a digital choice pantry system at 14 pantries throughout the city, where folks can use their phones or however they access technology to order online and schedule pickup so that they can interact with the food pantry system, both on their schedule and with full choice over what they're getting from a pantry in a way that works much like any other sort of grocery delivery or grocery ordering app might work. We also have a mobile pantry that serves areas of the city where we don't work with a brick and mortar pantry. So for us, that's, mostly throughout Brooklyn, but also all the way up into like Riverdale in the Bronx. We drive that pantry around, and it can serve about 180 folks at any given distribution. And it changes from time to time, but we go to about 6 or 7 places every month. I'm sure Ben has the exact number on that, but I do not know it off the top of my head. And then we do a home delivery program for older adults who are Holocaust survivors. That's monthly home delivery of food for folks who have a little more trouble getting out of the house. It serves about 2,000 people a month, I believe. At Met Council, like I mentioned, we focus particularly on kosher and halal food because we know from our experience that folks who abide by a kosher and halal diet will often forego other important things in their lives to be able to get access to food that meets their religious dietary restrictions. It would mean either not eating so your children can eat. It would mean not eating so you can pay rent. It would mean sort of maybe going into debt on certain other bills so you can afford the appropriate foods that you need. And there is a severe lack of service, especially in New York City, which is for both communities of Jewish and Muslim Americans, the largest in the country. We also know that New York City is specifically unique because of the diversity even within the Jewish and Muslim communities of the city. Neighborhood to neighborhood or borough to borough, folks have different needs and different requirements. As you can see here on the right, there's a whole lot of different certifications and certification bodies that different communities maybe trust in a different way or that work differently for different types of products. And so one thing we do here at Met Council with the help of our procurement agency relations team is we really understand and work with each individual community that we serve to make sure that we can get the foods that they need into the pantries that are serving those communities. But we often do that at our own cost. Publicly provided food, whether it's through the city's Community Food Connections program or the federal, the Emergency Food Assistance Program, TFAP, does not provide as much product as we need to make a balanced pantry bag and to provide sort of all the different food groups to each pantry. And so we rely disproportionately on philanthropy and private donations in ways that other pantries who do not meet the needs of kosher and halal observant communities do. As you can see down here, like it says, last year in calendar year 2022, only about 9.8% of food came to Met Council via USDA TFAP. In other pantries, that number is a lot closer to 25%. And so even though, as you'll hear often, emergency food resources are supposed to be supplemental and they're not supposed to be the only place that people are getting food. For our programs and for the folks that they serve, the publicly available resources are below even the supplemental level that they're supposed to be meeting. Additionally, even though we access and get close to 10% of our food from USDA TFAP, there's only 8 of 130 available products, only 8 of them have a kosher certification. And only 1 has a halal certification. Now, we've been working very closely with USDA over the past few years to really try to improve this program. And when we started working with them, I believe there was only 2 kosher certified products and no certified halal products. So there has been progress in the right direction, but it certainly is not adequate for us. And then there, within the 130 products, there's also things that maybe are possibly acceptable without certification, but if I'm remembering correctly, about 60% of the available products are not acceptable without a kosher certification to kosher observant communities. And I believe it's about 30 or 40% are still not acceptable to halal communities. And it's mainly because a lot of these products are canned and processed foods, and they require certifications that ensure they're meeting the needs of the communities that they are meant to go into. Here. And so one thing we've really been trying to do at Met Council, especially since the onset of the pandemic, is to understand the communities that we serve through research. One thing that my boss likes to talk about a lot is that we really only understand emergency food traditionally from the supply side. What we are able to get into our warehouse is the data that we're able to report about our programs, but that data has nothing to do with what need is like in the communities that we serve. We can only really talk about food based off of what we have and what we can ship out, and often that's in pounds of food. But that can often miss need that's out there in communities and maybe folks that we haven't been able to reach yet. And so we've really been working on trying to get a better understanding of what is going on in the communities, both in New York City and increasingly, and I'll talk about it in a little bit, in New York State and the nation at large. So we have 3 charts here that are from 3 different reports that we've written over the last few years. On the top right, we worked with the on the top right, we held 2 national calls, one in the summer of 2022 and one in the summer of 2023, to talk with providers across the country who work specifically in the kosher and halal space. And this is just one sample of the questions that we asked, but you can see here that using publicly available resources, the pantries that we talked to representing multiple states throughout the country found it either very difficult or difficult to pack a balanced pantry bag at a rate of almost 60%. And so that means that across the country, the issues that we're facing here in New York City are also affecting other pantries and emergency food service providers across the country, and just lends itself to sort of the need of a national solution to these issues. We actually are uniquely lucky in New York City that we have large communities and we're able to source philanthropic resources and donations to better serve the communities that we work with. A lot of these pantries that we talk to, or maybe they're the only kosher or halal serving pantry in the entire city or even in the entire region, don't have those resources and often are not able to rely on their food banks to get access to food products. On the bottom left, you'll see this chart that shows a program that ran in New York City during COVID. It ran from, I believe, April of 2020 through late 2021, and it offered kosher and halal and a few other different meal categories for home delivery to folks who could not get out of the house during COVID. And for us, it was the first time we were able to see demand side data for kosher and halal food, where folks would call into 311 at the city and request meals, and then within that they could request kosher or halal meals. And so we were able to see that through the life of this program, 21% of folks that called in and requested meals requested either kosher or halal meals. With this, is also this information was available geographically, so we were able to look at the city and see where throughout the city these requests were coming in, and try to gain a better understanding of where maybe there were gaps in our services or where we could expand our work. Again, this is in a report that's much more detailed on our website. And then lastly, we partnered with the Institute for Social Policy and Understanding to deploy 2 questions on a nationally representative poll of Muslim Americans in 2022 to try to gain a better understanding of both food insufficiency within Muslim communities and halal observance within Muslim communities. And what we found through this polling, that roughly 83% of Muslims across America observe a halal diet or prefer to observe a halal diet. And within these communities, food insufficiency was 10%, which was double that rate of all other respondents to the survey. And so what we've really learned from this is that halal observance is very important within the majority of the Muslim community, and that food insufficiency is also significantly higher than it is in almost every other religious minority within the country. Again, it's a nationally representative survey, so it's not a one-to-one across the entire country, but it was the first time that we were able to get a national look at what's going on in these communities. Like I mentioned, we're also doing some work at the state level. This year, we're engaged in research, looking at what need is like in Jewish and Muslim communities outside of New York City. This is very much in progress research that we are not, that it will be done in the middle of 2024. So it remains to be seen what the results of it are, but this map shows just a quick snapshot and an example of some of the things that we're expecting to find in terms of the size of Jewish and Muslim communities outside of the state, and then also looking into pantries that serve those communities. We have had some success at the city, state, and federal level. In our policy work, we've been able to significantly expand the city's offerings of emergency food. Now the program that the city operates offers but there has been improvement in that region. At the state level, we've been able to expand funding for the emergency food programs available through the state, both HIPNAP and Nourish New York, which we're very excited about, and we're hoping to continue that push this year. And at the federal level, like I said, we've done a lot of work on TFAP, and we're continuing to chip away at TFAP, but we've also really pushed federal programs, and we're looking towards the Farm Bill coming this year. And if we have some time at the end, we'll talk a little bit more about our goals for the Farm Bill, but as another opportunity to really make some significant progress at the federal level. We have a few more slides if we have time at the end, but I'll stop sharing for now, and we'll go back to Karla to talk a little bit more about our halal program and the growth of our halal program during the onset of the COVID-19 pandemic.
Great, thank you, DJ, for introducing that work. Our policy and research and advocacy work is really where Met Council's expertise and experience, and frankly, establishment in the larger, broader, general food, world of emergency food has been so impactful. I'll speak a little bit more towards kind of the other side of what Met Council food programs does, which is get on the ground, establish relationships with communities, community leaders, faith leaders in the Muslim and Jewish diaspora and communities in New York City, and using that experience to inform this policy work, which, as we've heard from all of the other presenters and everyone else on this call, is such a significant part of making change in the city. So DJ introduced our work a little bit. I'll just go a little bit more into what our halal food program is. As we mentioned, we've been working with kosher observant communities for a very long time. During the pandemic, we, along with the city and along with other funders and organizers, recognized this extremely highly underserved and underacknowledged need in Muslim communities. So during the pandemic, we piloted a halal food program working with 7 food pantries across the boroughs to start to understand and gauge where and what this need was. Just to give you an idea, in the past year and a half, we've moved on from 7 partner pantries, halal pantries, to now working with more than 20 on a regular basis. So that's either monthly food service or particularly focusing on holidays and special events when a lot of these communities require more support, not only because they need more food and because of pricing and etc., but also because their cultures require more food. I think a really good thread that has been going through this conference has been the cultural needs beyond nutritious needs. So that's where Met Council and other organizations are coming in to try to make an impact. I'll just start off with so these conversations are very broad and can, I think the goals can get lost sometimes, especially when we're working at city, state, and federal levels, particularly as it pertains to cultural and religious observance. So our goals at Met Council are to prioritize high quality, nutritious food, utilize technology to improve operations and access, build a more dignified model of service, and to advocate for an emergency feeding system that meets the needs of diverse communities across New York City. So we serve everyone, and I'll go into each of these a little bit more as I speak, but I think where Met Council comes in and where our fellow organizations come in is looking at these goals. I mean, the city shares these goals, and so do a lot of governmental organizations. You know, we want to provide nutritious food, we want to increase access, we want to build just access, and we want to serve with dignity and in a trustful way to those in need. But where we're filling the gap is everyone, those are kind of basic rights when it comes to access to food. What the problem is in our system is that those who are marginalized in a lot of ways, those who, for example, are socioeconomically less fortunate, those people deserve the same nutrition, access, and dignity as everyone else in the city. So as DJ mentioned, we're serving very, very, very diverse communities within Jewish and Muslim communities in New York City, especially. We're serving people from different ethnic backgrounds, socioeconomic backgrounds, different neighborhoods from different countries, a lot of immigrants coming from different countries. We have Orthodox and ultra-Orthodox Jews that we're serving. We have what we call the Amanamsa community. It's an acronym standing for Arab, Middle Eastern, North African, Muslim, and South Asian communities, immigrant and refugee communities as well, which is where a lot of our partner pantries really step up to plate. I'll speak. So these communities, research shows, and we have some research that we're happy to share with you as well, and also just on the ground experience shows are typically just marginalized in a lot of ways. There are plenty of factors coming into play: high costs of living in New York City in general, inflation, end of pandemic aid, which has been very, very negatively impacting these communities. Just for example, the Pew Research Center in 2017 published a report: Muslim Americans, statistically, they're less likely to have stable jobs and lower incomes compared to other Americans. And this is a huge barrier to accessing culturally appropriate foods, which can tend to be a little bit more expensive than other more accessible foods. These communities that we work with in both Jewish and Muslim, in both the Jewish and Muslim communities, tend to be larger multi-generational households. So seniors, children, young adults, all in one household to feed, and that can make things really, really, really difficult. Another thing that comes along with marginalization and things like xenophobia is that the data is not really there for us to be able to gauge need, and that's another place where Met Council is doing great work, like what DJ spoke to. Historically, so much of how we serve and who we serve and what we serve can be based on just the food that's there for us to serve, and it's not as much based on what the actual on the ground need is, which is where my work and the work of agency relations comes into play. So what we do in our agency relations program and what I'm doing in the halal food program is working with anywhere from religious institutions, youth centers, schools, community centers, synagogues, masjids, mosques. We're gauging the need, we're mapping the need, we're reaching out to leaders, we're networking to figure out where we can be of most help. In our research, we found that South Brooklyn and Queens tend to be very, very high need areas, and that's where a lot of the concentration has been since I was onboarded, and in the past. We are always looking for more places to give our support. So if anyone on this call knows of a specific location or pantry or organization which is looking to get into the world of food service, anywhere across the 5 boroughs, we're looking in New York State and beyond as well, please don't hesitate to let us know. What we do with these food pantries or organizations before they become food pantries, first and foremost, is provide kind of the technical and organizational service, which, I mean, some of these people and community leaders are serving food from their living rooms or from their garages, you know, to passersby who just come across and need food. And that just goes to show the big hearts of the people that we're working with, and how important of a role that anyone on the ground can play in the city and in assisting those in need. So a lot of what agency relations is doing is making sure that they're set up properly to mostly meet the standards of governmental and public funders, so that in the future, if they don't have so already, we can help them access public funding, which is so fundamental to the service that we do. And unfortunately, we don't get enough. I don't know if those beyond Met Council know that, but it's kind of common knowledge in our world is that it's so much more than, we need so much more than what the government and the city and the public funders are providing us. Met Council supplements that a lot with philanthropy and internal funding. So we do that, and then we educate in another technical and organizational way. We educate these pantries and these community members on how to best serve nutritious food in a dignified way, which are aligned with our first goals that I mentioned. So the USDA has guidelines about how to serve healthy foods, and we do our best to provide those agencies that we're working with those foods and educate them onto how to best serve their communities. So whether that's with pre-packed bags that already include the different compartments, so what are they, protein, fresh vegetables, starches, etc. Or as DJ was mentioning, we have a client choice model or grocery store model where clients can come choose the foods that they want or need, either digitally or in person, and making sure that everyone has the right safety trainings and the health trainings, and all of these just go into play into really establishing these agencies and organizations so that they can most efficiently serve their on-the-ground communities with public funding or with our support. And then just really just gauging, the other part of it is gauging what the specific cultural and religious needs are by speaking to the pantry clients, by speaking to the leaders of the pantries. Some things that we focus on, as has been the common thread again throughout all of our conversations, is making sure that these religious and cultural groups have the foods that they need and want, to be frank, in times where food and culturally relevant food will really play a big role in their sense of identity and their sense of community. The values, I think one great use that this conference is having and can have is to really share the fact that so many of our different groups and religious and faiths and cultures share a lot of the same values. I think it was great that our Buddhist friend at the beginning, I forget his name, excuse me, started with those 3 Buddhist values about what the illness of hunger really is, how it plays into life, beauty, health, happiness, and mental clarity. So really just like identity and perspective on the world, and also sharing. Sharing food and charity are such fundamental values in both Judaism and Islam, and I think across a lot of faiths. So Met Council does really great work with our network of 100 to 150 pantries of focusing on holidays and specific cultural events. So Ramadan, Rosh Hashanah, Hanukkah, Eid. There are a lot in the Jewish religion. For example, well, last year, something that was really, really exciting for the first time for Eid al-Fitr, which is at the end of Ramadan. In 2023, we worked with a local, very trusted halal grocer, Baladi Foods, who is a community member. He knows the community. Baladi as a name is very trusted, and the grocers there are very trusted. We worked with them to provide to our Muslim friends over 40,000 pounds of dates during Ramadan. Dates, as some of you might know, are extremely culturally and traditionally valued during this season, and also extremely expensive and hard to access. So that was something that Met Council did, along with providing over 10,000 pounds of halal chicken, which through our advocacy, along with other organizations, is recently added to some public funders' lists of accessible foods. Those things, or for example, providing apples and honey during Rosh Hashanah, matzah and grape juice during Passover. Those are where our organizations are really filling a gap. And by doing this, by working on the ground, by forming relationships, and by having convenings like this one, that's where these conversations will be brought to higher levels. You know, we're trying to advocate for access of food in a dignified way for every single person that we can, not just those that are easiest for funders or for the government to address, or to really understand. I think there's, as I said, there's marginalization and xenophobia in general, just like under acknowledgement of a lot of these communities. And without placing blame anywhere, that just leads to a lack of understanding. And Met Council and all of our friends and colleagues, that's where our biggest role is played at Interfaith Community Center. And all of us is trying to just increase understanding and then share that understanding so that everyone who's playing a role in the game can do their best to provide. So fortifying our network, expanding our network, increasing awareness and advocacy in doing all of that. Broad goal, we're trying hard. Sometimes this happens slowly, sometimes this happens bureaucratically, as we all probably well know. But the more we do, the more conversations we have, and the more we work on the ground with these community members, that will help us inform policy efforts and advocacy and research. And I think that's an ultimate goal to focus on right now.
Great, thank you. DJ, go ahead.
I was just gonna hop in on that last point too. I think that's a really important point about how we build our policy work and our advocacy work, and how it sort of is as much as possible from the bottom up. I mean, like, you know, we are operating a food bank, and our food bank has certain needs, you know, that we have to respond to, but at the same time, we also work directly with clients and with pantry providers and operate a food bank. And so we're able to really view the issue from like sort of all three levels of emergency food. And I think it gives us a very interesting and unique perspective. And we often, when I'm doing policy work or need information about a specific issue, I through our agency relations team, I'm able to reach out to providers that are interacting with a given program, or to even do some surveying or polling of clients that are interacting with a given program, and really get firsthand input that then we can give to local electeds or state or federal electeds, and really try to inform our work from the ground up, which I think is a very unique perspective. I think often in the emergency food world, representation and policy is driven by like very large food banks and sort of more like wholesale providers across the country. And Met Council is in a unique position, I think, to sort of speak to all levels. And it's really important to our work.
I think that's great. Actually, it's perfect segue to my question that was going to be to you, to DJ, is I wanted to understand a little bit more about how Met Council does advocacy work and what that advocacy work looks like from starting from the bottom going up. So if you can give us just kind of, because you touched on it a little bit before, but like let's get into this. Like I want to know.
Yeah, I think I like to think about our advocacy in sort of two buckets. There's sort of the annual advocacy about certain policies or budgets or legislation that is on a regular calendar. like, the city, state, and federal government are going to pass budgets for programs every year, unless you're the federal government, you still have not passed a budget. But so we do these like sort of long term, we know what's happening every year, and we work on policy. We work on like, budget number recommendations or programming improvements. We're coming into sort of the city and state budget season right now. And so like internally, I've met with our teams and sort of asked them what issues they're having with programs, so that then I can try to funnel that into what will eventually become sort of testimony that we give on the state and city budgets. We also work in coalition with a lot of folks here in New York City. So we will pen letters alongside large partners like City Harvest at times, or we all sort of coordinate to make sure that we're asking for the same dollar amount in a specific budget request. And that's sort of the constant and persistent policy work. And then there's the very long-term projects we have. So since I've been at Met Council, which is coming up on 3 years, each year we've published an original research report of some kind. The first one was the Get Food report that looked at sort of folks who were requesting religiously informed meals during COVID. And so that was literally directly informed by clients that were interacting with the programs. And then since then, we've also held those listening sessions. We published a report on that. We published a report on the polling of Muslim Americans. And so those longer term projects, to me, I like to think of them as, what are these unanswered questions that are out there that could benefit our programs and our clients, and how can we answer them? And then usually all of those reports then inform policy recommendations that we put in the end of the reports and that become part of our advocacy portfolio. And so that's like, these longer term projects. Right now, we're working on a New York State one that hopefully at the end of it, we will have a much better understanding of Jewish and Muslim communities across New York State, and also have built connections with providers across the state that are interested in pursuing statewide advocacy to better serve Jewish and Muslim communities who aren't in New York City. And then there's sort of I said 2 buckets, but there is actually a third bucket, which is sort of triage of things that come up, whether that's a hearing, whether that's somebody proposing new legislation. We work sort of on as fast as we can to respond to the needs of the communities that we serve. And that can be very different at different times, and sort of just comes to us as it comes, and we work on that as well.
Thank you. We had a question in the chat, but I also wanted to open it up to Adam, if you have any questions before I read the one that's in the chat. No pressure.
No, you may see me like looks like I'm glassing out. I'm actually taking copious notes. I'm screen grabbing your presentations. It would be lovely if you might share original copies of them. I don't know if that's possible, but it's very informative and it's very interesting. And I did not know about a lot of this work, and it's good to know. So I'm also embedding in my notes little things like, oh, I could follow up with Karla or DJ later on on whatever. I'm trying to figure out where I could add value, be helpful, do something. So I don't.
Great.
And you can certainly policy@metcouncil.org if you want to reach out, and we can continue the conversation, or I can share this slide deck with you as well. Happy to do that. Quickly I'm sure Karla, you have an answer to the question in the chat from your perspective, from a policy perspective. I think our biggest obstacles are a lack of data and a lack of flexible funding. Everybody wants more funding for their programs. We work in the nonprofit sphere. There is never enough. But I would say that, like, if we're not going to get more funding, how we're able to spend the money and how we're able to use the money, I think would be the next best thing that we could do. Every time we talk to pantries, they need more funding for staffing, but people don't want to pay for staffing. They just want to pay for food. We are very lucky that we have been able to get funding for policy work. Most organizations don't have that and aren't able to participate in policy work. And you would just see, you know, somebody working on policy who's also working on operations and working on programming instead, and like wearing 3 hats. Where at Met Council, we're very lucky that we've been able to like really prioritize policy, but across the board, that's difficult for a lot of the organizations that we work with. But I want to let Karla hop in here and maybe answer a little bit about, just from like a halal coordinator perspective, what you might say.
Yeah, so agreed that funding is our main issue, and like where this funding can go. I think so. For example, some opinions onto where to funding can go, and I don't necessarily have the solutions. I don't know if any of us really do, and that's why this is a great way to brainstorm. But one barrier that I see, so a lot of our work has to do, as I mentioned, with trust and service. Trust is a huge value for many of these insular communities, for lack of a better term. Like, they really rely on trust, and we spoke about this in terms of schools as well. No one wants to eat food that they don't trust, right? So I think that a really great thing that an obstacle, but also a really great thing to consider would just to bring more of these community members to have jobs, for example, or just to have voices at higher levels. So, for example, at food banks, at the city, at the state, at the federal levels. I know one of our policy recommendations to USDA, which I can't speak fully to, was to implement an office. Was it religiously inclusive, or was it particularly halal and kosher? I don't remember.
As it stands now, it is generally pitched as an office of kosher and halal. There's maybe somewhat of an understanding that it would have to be slightly more expansive for it to work at the federal level. But we've been working on how can we have in-house expertise on kosher and halal needs at USDA.
Yeah, so going back to, I guess, more expansion, a reflection of the work that we're doing at places like the USDA or in the city, so that these conversations can really be led by, not only supplemented by but led by the people who have these needs. I find a big barrier, for example, also beyond the awareness, is also things like language. If we have more expanded language access, then like this really, things like that, they're part of culture, and they really play a big role in trust and in research and in understanding. So trying to, there's advocacy, but there's also just simply saying, like, let's get a halal and community food coordinator at USDA. Like, let's get a Orthodox food coordinator at what am I saying? At the city, at the mayor's office for food policy, or like just making sure that we use funding, as DJ said, not just for food, but also things like staffing and bringing on more diverse staffs and more knowledgeable staffs, and staffing with more to make the conversations more open and to make the conversations more just. Another thing that funding can really help for, that's underfunded in my experience, are just technical things like refrigeration or more space. As I said, some of these communities are literally just like walls of food, and not that every food pantry wants to be huge and serve a huge community. Each pantry plays a different role, but we see that sometimes the food that we're receiving is not accessible to all communities, just because they don't have the technical support or the space or the refrigeration to be able to manage it. So those are a few things where I see as obstacles. And sometimes I'm like, okay, those are a little bit more easier to fund and to support than culturally relevant foods for every single culture and religious background, which is something that long term we're pushing for nonstop. But these smaller things, these things that are a little bit easier to achieve immediately, can play such a big role in like that longer term goal.
And just to add to that a little bit, Karla, I think as I think about policy, and especially I mentioned the Farm Bill, and nobody knows when the federal government is actually going to get to the Farm Bill. The general thought is they're going to maybe delay it for a year, but a lot of the way that I think about how we can change federal programs to better meet the needs of Jewish and Muslim communities is through just changing small ways in which folks do procurement and operate programs and practices that don't necessarily require additional funding. But you know, if you're going to put out a bid for a vendor, can we prioritize foods that meet the needs of all these communities rather than just the lowest maybe dollar amount? And one thing I also just want to make very clear is we in-house have done some collective purchasing and some research that shows that we've actually been able to get kosher certified product and halal certified product at equal, if not less, than non-certified product. We've in fact we're proud of ourselves. We've outbid the state for kosher products sometimes and gotten kosher product cheaper than the state was able to. And you know, like there still remains issues with things like kosher and halal certified chicken tend to be a little bit more expensive, but for vegetables and for canned goods and processed foods that we interact with a lot, or shelf stable foods, the idea that just having a certification will make it significantly more expensive is a myth. And we know that we can serve our communities for close to, if not less than, the cost of serving them non-certified foods for a lot of the food that we provide.
Thank you. And just thinking about this, and I appreciate both of your perspectives, because I feel like, Karla, you're on the ground doing this, and then DJ, you're looking at this from a state and like city level sort of. And I wanted just to understand, like, just kind of like what Joel's question is, but just a little bit more catered to Karla, like, how do you navigate the challenges with your partners on the ground? Because and I just want to be very transparent, like as a Jewish organization coming into a Muslim community saying we can help you offer more halal food, right? Like, how do you navigate that? Because there's this issue of trust, right? And it has nothing to do with you personally or your organization, just in general, right? Like, how do you form that trust and understanding with these communities that are outside of, I want to say, and this is new, your role is new, but like outside of Met Council's normal, communities that they work with?
I will also, for sake of transparency, this is a tension, and it's a tension the other way around too, and among faith communities in general. And this is where like interfaith's work, ICNY's work comes into play, So it can be a challenge sometimes. I would really like to appreciate the fact that like the people that we're working with are really, really good people. And no matter what, I think what I try to emphasize in my work, and in our work in general, is like we're not serving Muslim or Jewish, we're serving everyone who needs food, and those are where the values among our faith backgrounds really align, and that's what all of our work is about. So I just try to emphasize that in my daily conversations, and I will say that I think a lot of my work in terms of navigation is just trying to have open and transparent conversations. That's like the biggest thing that I personally can do and that we all can do. Transparency and openness is so key. And then these are more goals. These are goals to work towards are bringing the community in, I specifically am planning in the future and have been doing so in the ways of things like pre-Ramadan convenings, agency-wide convenings, which bring all of our halal food pantries together in a specific, unique space to be with each other, not necessarily relating to the fact that we're a Jewish organization. Those are really, really important. And in the coming year or so, I'm planning to have more regular convenings, hopefully form some kind of coalition or partnerships where we can have real advisement. Just also for transparency, I grew up in a Muslim household, Muslim Turkish household. I have Jewish background. I am not here to advocate for one or the other. We are all here to, my real background is in anthropology of food and where there is a gap in food service and how people of all identities require food. So I think what we try to do, and Met Council is general, like, yes, we're a Jewish organization. Yes, we're funded by other Jewish organizations, but the ethos is much beyond that. And we really try to not step into any spaces. We try to elevate those voices who are doing the work that frankly Met Council can't do or isn't doing right now, you know, and it's so much about collaboration and it's so much about raising voices. And the real impactful part is that's where it comes to our policy and research. You know, we are doing real research, for example, with ISPU, which is a Muslim organization. Incorrect.
Social policy and understanding.
Yes, exactly. And there's another organization, Arab American Family Support Center, who some of you might know. We're doing great work alongside them, Muna. So there are all these organizations that we're partnering with really to do the work we're doing. There's always tension. There will probably always be tension, but the tension is where we try not to focus or where we try to kind of move beyond and above. But yeah, this is where the work of these kinds of conversations that we're having right now. Are we running out of time?
One final question.
Okay,
We're like
sorry.
45 seconds left.
I could go on and on.
No, it's just I think Joel's question is great because you kind of went into it, which was just like, what is the larger way like the interfaith community can really help support what the council is doing in our communities. And I realize that you won't be able to really get to it, but just share it some way, and then if we can do it.
I would say this is what I was going to mention too. Like, tell your community to get involved. Tell your community to, if there are people already doing so, try to do more. You know, like any religious institution can do what we're doing.